Hello ladies and gentlemen, and welcome to today's video podcast. The topic for today is arthritis. Arthritis is a general term referring to inflammation in a joint. It is also called degenerative joint disease. It is a very common problem that may affect all of our pets, and hopefully within 5 minutes you'll be able to answer the following questions. What is arthritis? What are the symptoms of this disease? How is it diagnosed? And finally, what causes arthritis? To answer that question, we need to be familiar with the structure of a normal joint. A joint is formed when two bones are joined together and held in place by supporting tissues. The moving parts of the joint are encased within a capsule. This capsule is filled with some fluid called synovial fluid, which acts as a lubricant. In the normal joint, the bone surfaces which meet and rub together are covered with a thin layer of cartilage. The cartilage is an elastic substance that has no nerves. When it touches the cartilage of another bone, it acts as a cushion and there is no pain. Well, arthritis is caused by the wearing down of that layer of cartilage. The problem is that bones do have nerves, and when the cartilage wears away, the bone surfaces become less well protected. The bone beneath the cartilage gets exposed and becomes inflamed. As inflammation progresses in the joint, the capsule becomes thickened, less elastic, and highly sensitive. Bits of the worn-down cartilage may float in the synovial fluid. The joint becomes swollen and inflamed, and bony spurs may develop. As this happens, the discomfort and the pain prompts the patient to reduce the use of the affected joint. Due to the decreased movement, the muscles around the joint waste away and the ligaments become more lax. This increases the instability and it leads to even more degeneration of the joint. Following what we just said, joint pain is the obvious answer, and the signs will depend on which joint is affected. In general, the first symptom is lameness, and the animal will try to put more weight on its good legs. The patient may get reluctant to walk, climb stairs, jump, or play. As already mentioned, there may be some reduction in the size of the muscles of the sore leg. Many times, the pet may find it difficult to get up after lying down and appear stiff. Depending on the amount of pain experienced, there may be changes in appetite and behavior, and some of our patients will also lick or bite at the painful joint. Finally, I would like to mention that in practice, it's quite difficult to correlate the degree of pain with the severity of the disease, and while mild cases may appear very painful, some others with severe disease may be coping quite well. A diagnosis is made upon finding the classical symptoms associated with pain on manipulation of the affected joint. X-rays need to be taken to confirm the diagnosis and to determine the severity of the disease. Let's take a look at some of them. We're not going to go into any details about the anatomy of the joints here, as we hope to discuss every single joint in a future podcast. The aim is to show you the distinctive radiographic features of arthritis, namely the bony spurs. Let's take a look at a knee joint. This is the right leg of a dog. Although this joint is mostly healthy and most joint surfaces are smooth, we can see some very early changes associated with arthritis. You can now see the arrows pointing towards some small bony spurs that are forming on the shin bone. Now, let's have a look at the left leg of the same dog. Here we can clearly see some large bony spurs affecting almost every aspect of the joint. Clinically, this arthritic joint was painful and swollen. Wear and tear, which occurs throughout life, may reach a stage where the cartilage of the joint becomes worn, exposing the underlying bone. This leads to arthritis. Therefore, getting old is usually a good enough cause for arthritis. Now, obviously, some more specific problems will also act as triggers and explain the development of arthritis in young to middle-aged patients. A joint infection or an injury, for example. Some congenital disorders, such as hip or elbow dysplasia. Occasionally, a disorder of the immune system called rheumatoid arthritis will lead to joint inflammation and degeneration. Sometimes an unbalanced diet or an inappropriate exercise will be the cause. And finally, it's important to mention obesity as a very common trigger of arthritis in the UK. Whatever the cause is, the problem with arthritis is that it's a progressive disease, and if nothing gets done, it worsens every day. Fortunately, there are safe and effective ways of improving the quality of life of our friends that are suffering from this debilitating disease. You'll find 2 other podcasts dealing with the treatment of arthritis. This concludes today's video podcast. Thank you for listening, and remember to check out vetstoria.com for further podcasts. Please feel free to leave any comments and suggestions for future topics. Goodbye.